experiencing clogged ears, you're not alone. It's a very common thing, but I want to explain some great things that you can do so you can get rid of it naturally. But the first and one of the most vital parts of our ear anatomy is called the eustachian tubes. The eustachian tube is a narrow canal that connects the middle ear to the back of the throat, specifically the nasal pharynx. And its main function is to equalize ear pressure on both sides of our eardrum, which is crucial for clear hearing. And it acts as a pressure valve, opening and closing as we swallow, when we yawn, or when we chew to help maintain and balance that ear pressure. And when these eustachian tubes become blocked due to factors like allergies, colds, or sinus infections, it can lead to a sensation of clogged ears. And this happens because the tube is unable to properly equalize pressure or drain fluids from the middle ear, leading to that discomfort and muffled hearing. And one of the golden techniques to open up those eustachian tubes, which connect the middle ear to the back of the throat, you'll pinch your nose, you'll have a glass of water, you'll take a sip right here. When you take a sip, hold it in your mouth. You'll look all the way up, and then you'll swallow. And by doing so, this is going to help open up your eustachian tubes, help balance that and equalize that pressure. You can do this several times. I'd like you to understand the physiology behind this technique. When you hold your nose, you look up, take a sip, and swallow, you're essentially trying to open up the eustachian tubes, which connect the middle ear to the back of the throat, and here's how it works. These tubes help equalize the pressure between the middle and the external environment. They are usually closed, but they open during activities like swallowing, yawning, or even chewing. And when we pinch our nose, you're preventing air from escaping through our nostrils, which can help create that pressure in the nasal pharynx, the upper part of the throat behind the nose. And why do we want to look upwards? Because when we tilt our head back, this helps align the eustachian tubes in a way that makes it much easier for them to open. And when we swallow, the muscles in the throat contract, which help open up the eustachian tubes. And this allows air to flow into or out of the middle ear, equalizing the pressure. And we want pressure equalization because by equalizing the pressure, we will relieve that feeling of those clogged ears, which are often caused when there's pressure differences between the middle ear and the outside environment. And a few tips I want to share with you when it comes to opening those eustachian tubes. Remember swallowing. Swallowing opens those eustachian tubes. You can sip water, you can chew gum, whatever you need to do, but swallowing is something that will definitely help you. And another technique is called Valsalva's maneuver. You're gently going to pinch your nostrils shut. You'll close your mouth. You'll try to blow air through your nose, and this will help equalize the pressure of your ears. But do not blow hard. Little puffs like this. And as you do these puffs, air is not coming out of your mouth or nose. Do not blow too hard. You're going to hear your ears pop. You can hurt your ears. So you're going to do it lightly, gently pinching your nose. As it's closed, close your mouth, and little puffs like this. You feel little pops in your ears, but if you do it lightly, it's safe, and that will help open up those eustachian tubes as well. And placing warm compresses, a damp cloth, over your ears to help loosen congestion will be helpful. And steam inhalation is also very effective. Inhaling steam from a bowl or a hot water or even taking a hot shower, this will help clear that congestion, loosen that phlegm. And one of the most important things you can do to loosen that mucus and phlegm is drink lots of water. That helps clear any blockages. And lastly, head elevation. When you keep your head elevated, specifically during sleep, this will help drain fluids from your ears much easily as well. That will definitely work with gravity. And if your symptoms persistently get worse, it's definitely a good idea to consult a healthcare professional for further advice. So start utilizing these little tips. They will definitely be helpful for you. But very, very important, please hydrate. That water can do wonderful things for your body to get rid of that excessive mucus that can be causing many of your problems. I hope you enjoyed this video. Please share it with your friends and family. Leave your comments below. And most important, make it a great day. I'm Dr. Alan Mandel.